Here it comes. Hi, everybody. Welcome to Chai Chat with Dr. Anju Usman Singh from True Health Medical Center. Nice to see all of you here. I know it's been a long time since we got a chance to chat. It's been a really long year for all of us, and I hope you all and your families are doing okay, and looking forward to the spring and getting back to some level of normalcy. Grab your chai, grab your cup of tea, and sit down with me for a few minutes, and we're going to chat a little bit about seasonal allergies and mast cell activation. And it's a topic that is near and dear to my heart because I always call my children walking balls of histamine. And this is the time of year that my kids have trouble with issues like allergies, sinus pain, headaches, asthma is a big one for my family. And so I wanted to talk to you today about the concept of mast cells and how they relate to this whole concept of allergies. And I'm going to share with you a product that actually developed for my patients and my own family members because of this concept with allergies and mast cells. So I have my cup of tea here today, and in my tea I have a herb that many of you guys may not realize is a great mast cell stabilizer. It's called ashwagandha. And I also have some mint in my tea, which is also great for histamine type issues. So I'm going to share a portion of a PowerPoint that I did on this topic. And so I'm going to share my screen with you guys. And here we go. So before I go here, I just wanted to remind you that I'm not going to share medical advice with you. I'm trying to share here just advice on some of this education that I've learned, and I just want to share that with you guys. So I'm not giving you any kind of medical advice today, and you can share this information with your physicians and your clinicians to kind of help you move forward with this with these issues. So when we talk about mast cell activation and allergies, let's just take a step back. When you think about allergies and allergy season, what's kind of the first thing you guys think about? I mean, I think about itchy eyes, watery nose. I get this weird throat itch. I make a funky sound like that at night because my throat's itching, my ears are itching. And when we think about allergies, the first thing that comes in our mind is histamine, right? Like our body has these pollens or grasses are triggering our body to produce histamine. And now the histamine is causing all this swelling and itching and irritation in our mucous membranes. And then what do? We take antihistamines and we take decongestants to help us feel better. Well, some people don't completely feel better with antihistamines, and they help a portion of the symptoms, and they're not completely, eradicating the symptoms. So what else could be going on? Well, many people during this time of year have what we call mast cell activation. These allergens not only cause a histamine release, but they cause these cells called mast cells to release the histamine. Now, what's interesting about mast cells, and you can see this slide, it's kind of busy, but what's interesting about when mast cells are activated and then they release histamine, but they also release other, what we call pro-inflammatory cells or other inflammatory cells. They release things called TNF alpha, also interleukin-6, prostaglandins, leukotrienes, cyclooxygenase. And so very fancy words for a lot of cells that create inflammation. And when you guys think of inflammation, what do you think of? Well, in my patient population, inflammation also oftentimes is neurologic. So when we think of allergies, we usually think of these upper respiratory symptoms, but many people can have neurological symptoms from this mast cell activation. And some of the common symptoms that, again, we can see this time of year are things like anxiety, depression, poor concentration, insomnia, migraines, and this may be related to mast cell activation. Other common symptoms of mast cell activation are fatigue, muscle aches, bone pain, even digestive symptoms can occur. So these mast cells are often localized in places like the skin, the gut, the GI tract, the musculoskeletal system, and in the brain. And so that's why a lot of the symptoms we see with this are in those areas. So rashes is really common too, like flushing, hives, just swelling. And another common symptom is cardiovascular, meaning tachycardia, lightheadedness, palpitations. These can all be related to a mast cell getting activated. Now, in our minds, about things that activate the mast cell, the first thing we'll think about are allergens. So again, this time of year, the pollen, the grass pollen. But there's other things that can activate mast cell this time of year. A virus could do it, or a bacterial infection, or mold, or a fungal infection. So you might be thinking you're having allergy symptoms, but it may be related to being exposed to something else in addition to allergens or something else completely. I often see this in parents or patients who say, I have allergy symptoms, and when my doctor does allergy tests like IgE to mold or IgE to dust or IgE to foods, it doesn't show up. So these are non-IgE mediated symptoms. So again, these are mast cell related symptoms. So again, these are the main symptoms that we just talked about. So we do get the nasal congestion, the itchy eyes, but tachycardia, musculoskeletal pain, the anxiety, these can also be related to mast cell activation, difficulty concentrating. So at my clinic at True Health Medical Center, I always kind of look at things very integratively. And obviously, when we're thinking about histamines and inflammation and mast cell activation, we want to kind of keep our diet an anti-inflammatory diet. And again, this time of year, a low histamine diet might be very helpful as well. And the name of a low histamine diet is called a fail-safe diet. And it's kind of a low histamine, low phenol, low salicylate, a low amine diet that can just take the load off. Because if we're having activation and releasing histamine in our body, and then we're eating high histamine foods like chocolate and vanilla and bananas, then that histamine bucket can overload. So just wanted to remind you guys about how diet is important in this whole thing, and using anti-inflammatory agents. We're not going to go into other anti-inflammatory agents, but again, incorporating things like spices that are anti-inflammatory, like ginger, and herbs that are anti-inflammatory, like curcumin. Those can be very helpful. And even using anti-inflammatory essential oils like frankincense. But today in particular, we're going to talk about mast cell activation. And think about mast cell activation in my patient population is very common in my patient population with autism, patients with PANS and PANDAS. There's a lot of crosstalk beyond what's happening with PANDAS and flaring and what's looks like mast cell activation. There's a lot of similarities. I tend to talk about thinking about mast cells in patients who are flaring acutely and frequently. So with our PANS and PANDAS kids, they'll get a strep infection. They'll have a flare or an acute change in behavior associated with OCD, anxiety, and anorexia. And that will last weeks or months. And it'll take us time to kind of get over that. Whereas I'll get the history from some of the parents where, my child ate this and 20 minutes later they're flaring, or they're okay in the morning but not okay in the evening, or they're okay one day and not okay the next day. And these kind of up and down flares that are happening pretty frequently. Think about mast cell activation. So these little regressions that are happening really frequently. Allergies are associated with this. So family history of allergic type disorders, like in my family, the eczema, the asthma, multiple chemical sensitivities is very common with this as well. Eczema, food intolerances, chemical reactions to chemicals, reactions to temperature, changing in temperature like cold and hot, reactions to stress. Stress can trigger mast cell activation as well. And then patients with Ehlers-Danlos syndrome can also have, are more predisposed to having mast cell activation. Now, this is different than mastocytosis, which is a different condition in which there's an overabundance of mast cells. We're not talking about that today. Testing for this is very difficult. Many of you guys have heard Dr. Theohardis or Theoharides from Tufts University talk a lot about mast cell activation, and he is great at trying to understand a lot of the science behind this, and he's also a great clinician. So if you want more information, look at some of his lectures on this particular topic. In terms of testing for it, again, it's very difficult because the tests were designed to test for mastocytosis. So a lot of the tests give us clues, but they're not extremely diagnostic. The diagnosis is based on the history predominantly. So what can we do when we're having these types of symptoms and we tend to do well on things like antihistamines and having these seasonal regressions? What are some of the agents that we might want to try to do to kind of calm down the mast cells? And the reason that this is so important is because when we're dealing with just IgE-mediated allergies and just histamine, we take an antihistamine, we can feel better. But when we're dealing with mast cell activation, histamines are being released, leukotrienes are being released, prostaglandins are being released. So there's a whole lot of other things that we need to calm down. Now, if histamine is being released from the mast cell, another really important point is it's releasing all this stuff and we're just blocking histamine with antihistamines. We're not taking care of all that other stuff. And so by stabilizing the mast cells, we can not only stabilize histamine, but we can stabilize other pro-inflammatory cells. And we can prevent histamine from being released in the first place. So then we don't have to use our H1 blockers and our H2 blockers because we're already doing that after the fact. H1 blockers and H2 blockers are these antihistamines. They're blocking the receptors. They're not preventing the histamine from being released. And mast cell stabilizers can help the histamine from being released in the first place. And so again, taking these things proactively prior to that histamine being released, that histamine flare, can be very helpful for mitigating the symptoms that we see that we talked about. So some of the agents that I like a lot to decrease this kind of mast cell activation are, sorry, I pulled up the wrong slides. Um, so some of the products that I like for mitigating mast cells are quercetin. Quercetin is a really nice mast cell stabilizer. I'm going to shut off my slides. So hang on a second. Hang on a second. I just want to go back to the screen. Okay. So there's a couple of really key mast cell stabilizers that I wanted to tell you about. And I think my slides were just kind of confusing me. So the big ones out there that people talk a lot about are a product called luteolin, which is a very nice product. There's one called PEA, palmitoyl ethanolamide, also can help calm down mast cells. Quercetin is one that is very commonly used for mast cell activation. And there's a product, there's stinging nettles that's also used for this as well. Now, in the product that I developed called Aller-Mast, I have quercetin in that particular product, but I also have nettles. And I put a few other things that I really like. There's a herb from India called moringa. And moringa is a very potent mast cell stabilizer as well. It's a good antioxidant and an anti-inflammatory. And so it's a nice product that many people use for other reasons, but do not necessarily realize it can help with mast cells. Another product that I like for mast cells is milk thistle. Again, many of you guys use milk thistle for liver support, and it can also help with mast cell activation. So that's a very nice one as well. And then I mentioned that the moringa, the quercetin, the nettles, the milk thistle can kind of work together to kind of calm down inflammation. The other thing I like to use is an amino acid called L-theanine. And you might think about L-theanine, you think, well, that's for anxiety. And as I mentioned before, when these cells release, there's a lot of things happening. And it's activating the immune system, it's activating the brain. And when the brain gets activated, it stimulates cortisol and a lot of excitation and anxiety. And by using something like L-theanine to calm down that activation and calm down that excitation, we can calm down this mast cell experience as well. So by calming down cortisol, by calming down the adrenals, we can also help with mast cell activation. So in the product I developed, it has quercetin, it has the nettles, it has the moringa, it has some milk thistle, and it has some L-theanine. And again, there are other mast cell stabilizers that are out there that are natural, but these are the ones that I had put in Aller-Mast. There's also medications that can help with mast cell stabilization. Again, the medications have had some limited value, things like nasal chrome or gastrochrome. Ketotifen is a big one that some people use. Rupamine is one that's not available in the US, but available outside the US. Can be used as medications to stabilize mast cells. And of course, our antihistamines, our H1 blockers, our H2 blockers. Many patients do well with hydroxyzine, which is Atarax, and many patients do well with cyproheptadine as well, especially those picky eaters out there. So I hope I explained a little bit about this concept to you guys, and I hope you try to understand this whole role that mast cells play this time of year with some of the symptoms that we see. So I'm going to open it up to some questions. If you guys have some questions, please send them to me. I am looking for any questions that you might have to send me. Maybe I can't find them. Let's see. Oh, here you guys are. Thank you. So here we go. Just a second. So can you have a detox reaction from using something like Aller-Mast or using a mast cell stabilizer in general? Um, from this particular product, I've never experienced or seen a detox type reaction. Again, the milk thistle in there is to kind of support the liver. It doesn't tend to cause a big detox reaction. It's possible with some of the herbs and things like that in these types of products. They do have a little bit of a phenol effect. And so some people might potentially react to some of those. But in general, these particular products are pretty good for calming down that type of reaction. So I haven't really seen that type of issue with mast cell stabilizers and herbs that help with mast cells as well. So the question is, can you tell the best diet for mast cell and histamine again? Yeah, so the best type of diet would be fail safe, FAILSAFE, fail safe diet. And the fail safe diet is a low amine or low histamine diet. And so if you Google fail safe diet, you'll see that on that diet, there's more than just food on that listed on that diet. Just more than just the high histamine foods. And so it's kind of a low amine diet. So again, we talked about that amine bucket, histamine, dopamine, serotonin is kind of all in that histamine bucket that that we have to kind of de-escalate. Can mast cell activation contribute to hyperhidrosis? That's a great question. I do not know the exact answer to that. So I will have to look that up. But I think that kind of concept of the immune system being activated, turned on, and reacting in various ways, sweating can be one of those symptoms. So I'm not sure about hyperhidrosis, but that's a great question. Somebody asked if pans and pandas can be treated. Yes, I think pans and pandas can be treated. I know we're not talking about that today, but again, when we're thinking about pans and pandas, we're thinking about an autoimmune reaction and an immune activation, which is from an infectious trigger. And so many of those kids have this kind of a mast cell activation as well. And calming down the glia, the inflammatory immune cells in the brain, calming down the mast cells. And we didn't get into it today, but there's kind of a 1-2 punch with mast cells and microglia. So microglia are these immune cells in the brain, and they get turned on, and they create a lot of inflammation. And so all this is occurring in patients with mast cell activation. This is occurring in patients with PANS and PANDAS. And obviously we have to look at the trigger and treat the trigger, but we definitely can help calm some of this activation down so we can treat the symptoms. So good questions. Thank you. My thoughts on high IgE, despite Aller-Mast, Miraca, and avoiding allergenic foods on food allergy panel. So IgE, allergists say that if you have high IgE, that doesn't mean you have allergies. And you can have low IgE and have severe allergy to something. So high IgE doesn't always mean that you're having high symptoms. Some people have high IgE from a genetic perspective. It's called Job syndrome. And they have extremely high IgE and may not have any allergy symptoms at all. So IgE may not be the best way to kind of monitor benefit. I think you need to monitor the symptoms to see the benefit. And again, some of these immunoglobulins take a while to clear. So even if we're down regulating our immune reactivity, it may take some time to clear that IgE. Or for some people, it may not clear. So is there a thing as a histamine bucket where all of a sudden you develop allergies or mast cell activation? Is this a lifelong or can it be cured? I don't think it's a histamine bucket that's creating this sudden onset. I think it is something that, again, activated the immune system, and it usually occurs in susceptible individuals with susceptible genetics. Like, again, I mentioned my family genetics. And again, my patients with autism and PANS and PANDAS have that susceptibility to immune activation. And so some of the moms develop immune activation and may develop allergy, or other parents. I don't want to just pick on moms. Any of us can kind of develop these types of symptoms anytime. My own mom developed asthma in her 70s. And I do think that there is some type of a bucket. I don't know if it's just histamine, but I think there is a load that occurs where, our bodies have too many chemicals, too many metals, too many mycotoxins, and there's a stressor, and then our system is trying to stay in balance, and then something else happens, like we get a bad infection or a major stressor, and then our system kind of loses tolerance, and it's very hard to kind of roll all that back quickly, especially when there's multiple factors leading to that kind of breaking the camel's back. So, and I think you guys saw that with many of the regressions that you saw in your particular cases or in your children. And so I don't know if it's a bucket, but it is kind of like many factors put together, and then it just kind of overloads the system. Okay. So I got a question here from my friend, Dr. Antonucci in Italy. I'm prescribing Aller-Mast to my allergic patients for some time. Some of them, it's controlling seasonal rhinitis and conjunctivitis, and it's working on attention and hyperactivity, which means it's working on brain inflammation. Thank you for the tool. Oh, I didn't see that as a question, but thank you for being here, and thank you for your comments. So I'll answer one more question. Is this related to leaky gut? Can mast cell activation be cured permanently by fixing the gut? So, there are a lot of mast cells in the gut. And again, there are a subset of patients where this is a big issue for them. And if we can calm down the mast cells, we can calm down the inflammation in the gut, which can then help heal the leaky gut. Now, what I've been seeing a lot lately, and I'm just going to throw this out there, and I know it may sound a little bit controversial, but what I've been seeing a lot lately is mast cell activation from mold. And we're worried that some of the patients are colonizing mold in their own GI tract or their own mucous membranes. And I think that many of my patients are getting mast cell activation from the yeast and the mold that's growing in their gut. So they eat a little bit of sugar, they have a little bit of flare of the yeast, and then they're having allergy type symptoms or histamine type symptoms or mast cell symptoms, and they're flaring. We treat the yeast, they get better, but then when we stop treating the yeast, it's happening again. And I think for those patients, they actually have an immune reaction, immune sensitivity to their own yeast or mold that's going on. And so sometimes we'll use things like low-dose immunotherapy to calm down that immunoreactivity or that immune activation. And so I think for that population, I definitely have to work on desensitization and calming down that. And, we have people who do sublingual immunotherapy, people who do low-dose immunotherapy, and low-dose antigen therapy. And I think in some of these kids who are constantly activating, we do need something like that to desensitize them. So thank you all very much for your attention. I really appreciate you all being here. And I hope you all get a little chance to unwind, relax a little bit, take a few breaths, and have a cup of tea. And if you have any questions, send them my way. I'll be happy to try to answer them. Thank you very much. Bye.